ABC Pharma, Artificial Intelligence Doctor. Position-dependent discomfort in Aveir VR leadless pacemaker. Why TV watching versus music listening matters. Clinical question. Why does a patient with an Aveir VR leadless pacemaker experience discomfort lying down in the supine position when watching TV, but not when listening to music in the same position? This is a fascinating clinical observation that highlights the complex interplay between patient activity, autonomic responses, and leadless pacemaker function. Several mechanisms could explain this phenomenon. Most likely mechanism: rate response activation. The Aveir VR's accelerometer-based rate response is likely the key factor. When watching TV supine, visual and cognitive engagement creates sympathetic stimulation, emotional responses to TV content, suspense, excitement, drama. Trigger heart rate increases. The accelerometer detects these physiologic changes and increases pacing rate. More frequent pacing at higher rates creates greater mechanical sensation. In contrast, listening to music tends to be more passive and relaxing, with less pronounced heart rate variability. Contributing factors: 1. Head and neck position. Watching TV supine often requires the head to be propped up or angled forward. This creates tension in the neck, shoulder, and upper chest muscles. Altered thoracic mechanics may amplify awareness of the leadless pacemaker against the ventricular septum. 2. Breathing pattern differences. TV watching may involve irregular breathing, breath holding during engaging scenes. This changes intrathoracic pressure and cardiac position. Music listening typically maintains more regular, relaxed breathing. 3. Cardiac contractility. Sympathetic activation during TV watching increases contractility. Enhanced ventricular contractions create more pronounced mechanical interaction with the pacemaker tines/helix attachment site. Clinical implications. This could represent positional pacing discomfort exacerbated by rate response. Consider evaluating rate response settings, possibly reducing aggressiveness, assessing for proper device position on imaging, ruling out perforation or excessive protrusion. Patient education about activity modification. Key takeaways. This case illustrates how leadless pacemaker complications can manifest in unexpected, activity-specific ways. The Aveir VR's rate response sensor can create differential symptoms based on the type of cognitive and emotional engagement during similar physical positions. Understanding these nuances is essential for proper patient counseling and device programming optimization. Healthcare professionals should inquire about specific activities that trigger discomfort, as this information can guide both diagnostic evaluation and therapeutic adjustments. The distinction between passive and active cognitive engagement may be an important factor in troubleshooting position-dependent symptoms in leadless pacemaker patients. Return to ABC Pharma, Artificial Intelligence Doctor.